In CT urography, three imaging phase is used. One is unenhanced imaging. That means we do not use any contrast in this imaging. That's why it is called unenhanced. And then we use nephrogenic phase. Nephrogenic means we want to see the kidney in this phase, but how we can do it? We use contrast medium that is non-ionic. This non-ionic contrast medium is used as they do not react with surrounding tissue and side effects are less. So the non-ionic contrast medium that are used here, how much contrast medium is used? 100 to 150 ml contrast medium is used and their strength is 300 milligram per ml. So 300 milligram per ml strength non-ionic contrast medium, 100 to 150 ml amount is infused to the patient in the rate of 2 to 4 ml per second. So after administration of the contrast, we wait for 80 to 100 seconds. Then we can obtain the nephrogenic phase. This nephrogenic phase has highest sensitivity for parenchymal mass detection. And the third phase is excretory phase. When the contrast medium starts to excrete and comes to the pelvic region, we see in this phase the pylo, that means the pelvis. And after administration, we wait 5 to 15 minutes and then we acquire the pylographic phase. So this is the conventional method, but to reduce the radiation to the patient, we use different methods. Split bolus technique is such a method to reduce the patient, to reduce the radiation exposure. So here, instead of administering the patient at a continuous rate, we use IV contrast medium in question. That is, we use contrast medium in 2 sessions. Firstly, we administer 30 to 50 ml bolus and then we wait 80 to 10 minutes. Then we administer 80 to 100 ml contrast medium and then we wait for 80 to 100 seconds to acquire our hybrid nephrographic phase. So in the second stage, the numerics helps us to memorize this. How it helps us? So in the second bolus, we the second bolus is given after 8 to 10 minutes later from the first. And what amount is used? 80 to 100 ml is used. And after administration of 80 to 100 ml, how much time we wait? We wait for 80 to 100 seconds. So 80 to 10, 80 to 100, 80 to 100. So we can memorize. So lastly, we get the hybrid nephropylographic phase. It is hybrid because in this single phase we can see the kidney and also the collecting system pylo. But there is a disadvantage of this hybrid technique. Disadvantage is that when contrast medium is present in the ureter, if an isoattenuating tumor also present in ureter, suppose this is an isoattenuating tumor and contrast is passing by it, then what will happen? We cannot differentiate the contrast density and isoattenuating tumor density. But if we use diuretics, that will dilute this contrast medium, and then we can differentiate between the contrast density and the tumor density. Thus we can overcome the disadvantage of the hybrid nephrographic phase. So this is all for today. Thank you for listening.